Well, hello and welcome to this episode of Health Nuggets. Today, our focus is on the health and well-being of children. So we will be looking at neurological disorders or neurological conditions in children. Karibu sana, my name is Aida Munzatsi, so stay tuned. Health Nuggets starts now. Well, to help us with this conversation, I'm definitely joined with an expert, that is Dr. Nyakeri, who is a pediatric neurologist. Daktari, karibu sana, and thank you so much for your time.
Asante sana.
So just to start with, what exactly are neurological disorders?
Neurological disorders are conditions that arise from disorders or injury to what we call the nervous system. And the nervous system basically is anything that involves the brain, the spinal cord, the muscles, and the nerves. Yes.
All right. So now, before now we get to let me just say the types. How does a neurological disorder come about? Does it happen after birth or during pregnancy?
Right. It can happen at any point in anybody's life. So it can happen during conception. It can happen as well during the pregnancy, at any point during the pregnancy. During birth, we also have complications that can arise to injury to the brain. And thereafter, when the child is growing, at any point in time, from a newborn period even to adulthood, you can have any injury to the brain, and that can lead to neurological conditions arising from the brain. As well, you can have injury to the spinal cord or injury to the muscles and the nerves. Other than injuries, you can also have just conditions that arise. We call them genetic conditions that really, it doesn't happen because of an injury. It's something that just spontaneously happens, leading to damage to any of those systems that we've talked about.
Okay, and does this have to do with the mother as well? Maybe some risk factors that are not necessarily associated to the, let me say, brain injury to this child, but other risk factors now to the mom.
Right. So a majority of these conditions actually happen accidentally. Accidentally meaning that nobody really brought about the injury. So some of them just happen spontaneously. That is the most common reason. Other reasons could be infection. So if a mother has an infection during pregnancy, there is a risk of now causing injury to the fetus that is developing. Other than that, what we call exposures to could be alcohol, could be smoking, could be drugs that people take, and it could be recreational drugs. It could be also other prescription drugs that medical practitioners know not to prescribe to a pregnant woman. So it's very important actually for people not to buy medications over the counter and have them prescribed by a medical professional, at least during pregnancy.
Yes. I think that's well understood. Maybe we can now look at, let me say, the types of now these neurological disorders.
Right. So we have very many types of neurological conditions that present in childhood. Commonly, we have seizures. And seizures, you could be having epilepsy, or you could be having non-epileptic seizures. So with epilepsy, we do talk about somebody who has recurrent, what we call unprovoked seizures. Nothing brought on the seizures. And then we have the non-epileptic seizures, which can be multiple types. And commonly, we see them when a child presents with infections. So you have what we call febrile seizures, and then it could be brought on by somebody who has low calcium. Case in point, a child who has rickets and low blood sugar as well. Another condition could be headaches. So very common in children, even from as young as 3 years. Other conditions could be developmental delay. So with developmental delay, a child presents not having attained milestones at the appropriate time. So they've not sat at an appropriate time or walked or even running. Also talking, they may not have spoken at an appropriate time.
Okay. Now you've mentioned seizures for epilepsy. So how can a parent tell that my child is having a seizure? And for these other neurological disorders, what symptoms do they come with?
To start with seizures, a child will, we expect a child to be alert and to be active. So when somebody presents with a seizure, they do have signs and presentation where they lose their consciousness. They may have what we call jerking of the hands or of the legs. Their eyes may turn and turn to one side, and they may be having frothing or a lot of saliva coming out of their mouth. And all this, it starts at an abrupt time, and then it stops also at an abrupt time. That is how somebody may suspect that their child is having a seizure. Other signs or presentations of the other conditions, as we've talked about, so they may not achieve milestones at an appropriate time. Another thing could be what we know as headaches. So when a child starts talking and saying that they have headaches, or they may also just be banging on their heads to signify that something is not right. Yes, and also just irritability. You want to find out why is a young child being irritable, and we look at multiple other areas to try and explain why.
Okay, now I'll take you back slightly, looking at now the age group. When we're talking of a child and when we're talking of these neurological disorders, is there like an age where this cannot happen, or is it something that can happen at any time of this child's age?
So it can happen at any point in time. The only difference is that how a child can be able to verbalize or say their presentation. So a young child as young as 2 may be having pain in the head, but how do they describe it? That is something that we may not be able to understand. So for them, it may present as what we call irritability. So the child is crying and you're not able to ascertain why. The child is banging their head, or the child is just even shaking their head to say to show that things are not right. So it can happen at any age, just that the older child is able to say where what hurts.
All right, so Dr. Let us now look at how you tell after this parent, or when this parent now bring their child for diagnosis, how do you tell that this is a neurological disorder? You just mentioned of how you try and diagnose for you to know whether this is an epilepsy seizure or not.
So the main important thing will be for the medical practitioner to take what we call a good history. So the practitioner will talk to the parent and will also talk to the child if the child is able to talk to the doctor and find out how the symptoms, what symptoms they have and how they have evolved. So a good history can give us a diagnosis most of the time. And with a good history, we do examine the child, and that also contributes to a large chunk of getting the final diagnosis. Once we've taken the history and they've conducted a physical examination, then we may rely on investigations to tie up the story. So with investigations, you can do blood tests. We can do what we call a lumbar puncture. A lumbar puncture involves taking fluid from the back to be able to examine it and look for things like infection or metabolic conditions. Other investigations that we do is what we call electroencephalogram. In short, we call it EEG. And with EEG, we are looking at basically the electric activity of the brain. So that will help us point us to a direction of what epilepsy type somebody has. Another investigation that we commonly do is doing a brain scan. It can be a CT scan or it can be an MRI to try and look and see if there's any abnormality with the brain or even with the spinal cord to explain the presentation.
Okay. Now, after the diagnosis, of course, there is a treatment and now management. Once you've now realized that maybe, let's say, this child has epilepsy or this child has any other of the neurological disorder, what do doctors do, or what do experts do? And now what can I do as a parent now to maybe improve the life? Or
Right. So for management, it's also broad, and it's something that we like to involve and engage the parent and the child, because once everybody's on board, then we can safely work together to better the person's life. So part of management involves medication. So like in epilepsy, depending on what type of epilepsy the patient has, we can prescribe medication to prevent further seizures from occurring. The main thing is we aim for somebody to have no seizures in life. So medication is a very important step for that. Other than medication, there are what we call supportive management. Supportive management involves trying to have the child have as much a normal life as possible compared to somebody else who doesn't have epilepsy. So we are able to guide you and talk to you about what is important for safety or what is important for precautions. So we want somebody to be able to play. How do we play safely? We want to be able to swim for the ones who swim. How do we do it safely? And also in case of a seizure, what are you going to do? So we definitely talk about first aid for seizures because we don't want any injuries happening once a seizure has occurred.
So now you've mentioned the safety and the precautions to take. Maybe you can just share with us some of these safety measures and some of the precautions that parents can.
That's a very important question. The precautions are standard precautions for every child to avoid injury. So when you're riding a bicycle, we want you to be on a helmet. When you're doing your play activities, we don't want a child to be climbing trees. We don't want them to be climbing houses or heights which are higher than their height. Because should they have a seizure or an episode where they lose consciousness, they can fall down and get hurt. We don't want them to lock the doors when they access the washrooms or even in bedrooms, because should anything happen and a parent is able to hear from the other side, we need the person to have very quick access to the child to be able to support them during any seizure. In terms of infections, you need to treat infections so that we are not able to trigger seizures for somebody who has epilepsy. And also sleep is very important. We advise people to sleep for at least 8 hours, because once somebody is what we call sleep deprived, so you've not had enough sleep, that is enough to trigger seizures in somebody who has epilepsy.
Okay, so other than epilepsy, you mentioned of these other neurological disorders. What are the chances? You also mentioned of genes, yeah, as one of the risk factors. What are the chances of me as a parent giving birth to a child with let me say my first child had this particular neurological disorder? What are the chances of me now giving birth to another child with the same condition?
Right. That comes in terms of during assessment. We want to know what genetic change happened to your first child, to the first child that led to the condition that they have. Then that involves a blood test that we do, and it's sent for genetic tests. And once we get the results, we're able to know, is the mother able to pass it on, or did the genetic change just happen spontaneously with no chance of recurrence? So that information will be able to work with you and discuss based on further testing of your child and of you as parents.
Okay, now for this pregnant mom, how can they take care of their pregnancy? And also there are those injuries that happen maybe during birth. what will be your advice maybe to healthcare practitioners of how now to just ensure that this child has been born and born safely?
Right. So that is something that health practitioners, we want to avoid as much as possible. We advocate for hospital deliveries as opposed to home deliveries. Should the people who choose to have home deliveries, they do have safe midwives during the delivery to prevent such injuries from happening. During pregnancy, some of the things that you can do is there are supplements that mothers are provided during the pregnancy, somebody to take those supplements. Another thing is that they need to have close monitoring and close follow-up with the antenatal visits with a medical practitioner who will be able to direct and advise. And especially for those who are considered high-risk mothers, so mothers who have an added medical condition. So we have mothers who have neurological conditions, mothers who have other conditions that they may be on multiple medication. So they need to reach out as soon as possible to the medical practitioner who will review the medications that they are on, and in case there is any that may be harmful to their child, there are alternatives that they can be provided.
Mm-hmm. Well, thank you so much for sharing that, Dr. What will be or what would you want our audience to take home, that one thing that you want them to remember as far as neurological conditions are concerned?
I think the main take home is that parents are the first doctors of children, of their child. And they always have a suspicion of something being not right. We want them to have that intuition and present to the health facility, to a medical practitioner, and advocate for their child to seek appropriate intervention.
So they should not take anything for granted or assume any signs that might come.
Yes, I think that is the best way to do it.
All right. Thank you so much, Dr. for your time, and thank you for sharing that very insightful information with our audience today.
Karibu sana.
All right. Well, that's all we had for you on this episode of our Health Nuggets. I hope that in one way or the other, you're more informed about today's topic. And we were looking at neurological disorders in children with the help of Dr. Nyakeri. And if you're just joining us, remember you can always follow this conversation on our social media pages. That is CAC TV on Facebook and YouTube. My name is Aida Munzati, and thank you so much for tuning in. Until next time, your health matters.